The most important things I've ever done in my life have been in this hospital. Nothing will ever matter more than what I've done in this hospital, but it is killing me.
That is Emmy Award-winning actor Noah Wyle, the HBO's hit medical drama, The Pitt. We all know about it. His character has struggled with mental health on screen. Wyle is working off-screen to advance legislation supporting real-life health care workers. Now, he is back in Washington alongside nationally recognized surgeon Dr. Elisabeth Potter to push lawmakers for solutions to protect health care workers. Good morning to you both. Noah, let me start with you. It's not just words on a page that you're reading. You have talked to physicians, you've heard about stress and burnout, and you want to bring that to the Pitt.
Yes, I want to actually help change policy that affects actual lives and actual healthcare workers. So the Pitt has been instrumental in sort of framing some of the issues that healthcare workers are facing. And I think everybody's perspective is broadened because of what the Pitt has shown. But the next step is to actually change that into policy that changes the conditions that they're working under.
And what are the conversations you're having like on Capitol Hill when you raise these various issues, Noah?
Well, I try to bring along people that are way more knowledgeable on the subject than I am. Today, I'm just a fanboy. I'm here with Dr. Elisabeth Potter, who is actually walking through these issues every day in her practice. And we're here ostensibly to ask for three things. We're asking for a tax credit for healthcare workers, a $6,000 tax credit. We're asking for the Lorna Breen Act, which has been passed by Congress, to be fully funded to at least $45 million so that these programs can actually get out there and do the work that they're supposed to. And I'm going to let you tee up the last one.
We're asking for healthcare workers to be protected when they speak out truthfully about the things that feel wrong to them. I've experienced this in the last year myself, where you speak out and all of a sudden the system of healthcare wants you to be quiet. And we as physicians pride ourselves on telling the truth and getting to the heart of the matter, and we deserve that as well. So speak free and be protected.
So, Dr. Potter, tell us about your experience with mental health and burnout. I mean, I know from the doctors in my family, this is a very real challenge.
You know, yeah, I am someone who has lived through the healthcare system, and it wasn't until after fellowship that I looked around and said, I need help for me. And I went into therapy. And I was telling Noah the other day that I would have been a good doctor before therapy, but after getting therapy and learning to take care of myself, that made me a great doctor. So yeah, I think that the mental health aspect is real. I come from a family of doctors, and we have to take care of ourselves, and we have to make it normal for folks to do that, right?
Couldn't agree more.
Yeah, Dr. Potter, you posted a video that went viral. I believe you were in mid-surgery and an insurance company asking you to call them, and you helped develop something called the Speak Free Act after saying you experienced retaliation. Tell us a little bit more about that.
Yeah, well, last year I was, I've always been a huge proponent of insurance and of healthcare through insurance. And I had the experience of being in the operating room, operating on a woman with breast cancer, and being called by an insurance company out of the operating room to answer questions about why she needed to stay overnight and what her diagnosis was. And it was just so absurd, and it hurt me so deeply that I filmed a video about it. And what I expected to happen was that truthful information would be received, and we would all kind of work together to make it better. Yeah. But that's not what happened. What happened was the system tried to scare me into being quiet. And so with the help of FIGS, who has helped keep my practice open this year, we turned that really challenging time into the Speak Free Act, which is an effort for no one else to have to go through what I've been through over the last year, and an effort to really value the voices of our healthcare workers.
And Noah, very quickly, this is a family affair on Capitol Hill for you. Your mother is along with you.
My mother's here. This is the second time I've come to D.C. to lobby for these things, and we've been actually very successful. So this is the follow-up to last year's trip, and I'm here again with my mom, who spent her career as a nurse and who raised me to understand exactly what they do for a living and how important the support of our nurses are to the sustaining health of our healthcare system.
Noah Wyle and Dr. Elisabeth Potter, we thank you. And thanks to the healthcare apparel company FIGS, previously mentioned, who organized the Awesome Humans on the Hill initiative that brought them to D.C. for this important work. And we'll be right back.